In this video, we will explore about common cold and its best home remedies and natural cures. The common cold is a viral infection of your nose and throat. It's usually harmless, although it might not feel that way. Healthy adults can expect to have 2 or 3 colds each year. Infants and young children may have even more frequent colds. Most people recover from a common cold in a week or 10 days. Symptoms might last longer in people who smoke. Generally, you don't need medical attention for a common cold. Symptoms. Symptoms of a common cold usually appear 1 to 3 days after exposure to a cold-causing virus. Signs and symptoms might include runny or stuffy nose, sore throat, cough, congestion, slight body aches or a mild headache, sneezing, low-grade fever, generally feeling unwell. Causes. Although many types of viruses can cause a common cold, rhinoviruses are the most common cause. A cold virus enters your body through your mouth, eyes, or nose. The virus can spread through droplets in the air when someone who is sick coughs, sneezes, or talks. It also spreads by hand-to-hand contact with someone who has a cold or by sharing contaminated objects, such as eating utensils, towels, toys, or telephones. Risk factors. These factors can increase your chances of getting a cold. Age. Infants and young children are at greatest risk of colds, especially if they spend time in child care settings. Weakened immune system. Having a chronic illness or otherwise weakened immune system increases your risk. Time of year. Both children and adults are more likely to get colds in fall and winter, but you can get a cold anytime. Smoking. You're more likely to catch a cold and to have more severe colds if you smoke or are around secondhand smoke. Exposure. If you're around crowds, such as at school or on an airplane, you're likely to be exposed to viruses that cause colds. Prevention. There's no vaccine for the common cold, but you can take common sense precautions to slow the spread of cold viruses. Wash your hands thoroughly and often with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect high-touch surfaces, such as doorknobs, light switches, electronics, and kitchen and bathroom countertops daily. Cover your cough. Sneeze and cough into tissues. Throw away used tissues right away, then wash your hands thoroughly. Don't share drinking glasses or eating utensils with other family members. Stay away from people with colds. Avoid close contact with anyone who has a cold. Stay out of crowds when possible. Avoid touching your eyes, nose, and mouth. Take care of yourself. Eating well and getting exercise and enough sleep is good for your overall health. Treatment. There's no cure for the common cold. Most cases of the common cold get better without treatment, usually within a week to 10 days. The best thing you can do is take care of yourself. For example, drink plenty of liquids, humidify the air, use saline nasal rinses, and get adequate rest. Antibiotics are of no use against cold viruses and shouldn't be used unless there's a bacterial infection. Relieving your symptoms can include using over-the-counter medication to reduce fever, body aches, congestion, and cough. But there are pros and cons to commonly used cold OTC medication. Consult your healthcare specialist before taking any medication. Or try home remedies and natural cures. If you find this video informative and useful, hit the like button and don't forget to subscribe. Thanks for watching.